The oral microbiome, when it is in dysbiosis, when it's out of balance, where the bad bacteria outnumber the good bacteria, when there's inflammation in the mouth, that dysbiosis works its way into almost every organ. 54 systemic inflammatory diseases, you name them, have a causality connection, and your inflammation in the mouth is one of them.
Welcome to the Myers Detox Podcast. I'm Dr. Wendy Myers, and on the show today, we're going to have Dr. Jonathan Levine. He is just a biological dentist going above and beyond biological dentistry, and we're going to be talking today about mouth mapping and how your oral microbiome is so connected to your systemic health. And we talk about cavitations. We talk about the oral structure of your mouth and how that affects your breathing and sleep apnea. We really bust a lot of myths about fluoride use, oil pulling, what kind of floss you should be using, and doing a 2 to 3 minute care routine every morning and evening that can make a huge impact on having a healthy oral microbiome and what you should be doing to really prevent a lot of systemic inflammatory diseases and heart disease and so many diseases that are linked to infections in our mouth and poor oral microbiome. We're also going to be talking about mercury fillings. Should you have them removed if you have them in your mouth? And how even some composite fillings have aluminum in them. So, just a lot of really, really key concepts in dentistry, very advanced concepts in dentistry that you need to know. And we also talk about Jonathan's mouth mapping system, where he does a 2 hour assessment using cone beam scans and salivary testing and just really going above and beyond looking at the oral structure in your mouth and how that's affecting your health. So stay tuned if you want to have really good oral health. So our guest today, Dr. Jonathan Levine, he's America's most sought after oral health and dental longevity opinion leader, distinguishing himself among today's leading dental voices by providing approachable, data-driven insights that transform listeners from passive learners to active participants in their oral and overall well-being. As a prosthodontist and researcher, author, and innovator with 29 patents in aesthetic, therapeutic, and medical device technologies, Dr. Levine pioneered aesthetic veneers in the 1980s and established a multi-billion-dollar teeth whitening market as well. He's been practicing for 35 years at JBL New York City and recently launched smilehouse.co in New York. It's New York's eagerly awaited destination for integrative and functional dentistry. Beyond his clinical practices, Dr. Levine is committed to expanding how oral health is perceived and who it serves through his Glow Good Foundation. He remains dedicated to breaking down global barriers to dental care, delivering vital services, supplies, and education to underserved communities worldwide. You can learn more about his work at smilehouse.co. Well, Dr. Levine, thank you so much for joining us.
Thank you for having me.
Yeah, so why don't you tell us about yourself and your practice and the work that you've been doing over the years?
Yeah, sure. Well, it's been a 3.5 decade career. Um, but interestingly, I think my story really starts where I was in college. I was at Cornell. I was an immunology microbiology major and a lacrosse player. I was very lucky to have a great coach, and we ended up, by our senior year, um, winning a national championship. And kind of this group of guys with an amazing coach, really putting it together of having each other's backs and really building the kind of relationships that you can win a national championship. It's not about me, it's about us. So I tell you that because I chose dentistry because it was a bit of a process of elimination. I thought I stayed next year getting a master's in immunology, and didn't think it was gonna be enough for me. Didn't like hospitals because of the experience I had with my grandparents who passed away. And, um, and I was working with my hands. I was doing some sculpture at Cornell. And I said, wow, dentistry could be interesting. I knew nothing about it, but I jumped head in. And I came out and I went to an amazing school, Goldman School, Boston University, where it was very much a medical and dental. I was in medical school for the first 2 years, which was great. We were med students, dental students, and PhD students. I get into the profession and I see a profession that's fragmented, siloed, individualistic, somewhat collaborative, but very conventional, where everybody had their office. Kind of 70% of the dental practices was one dentist, one hygienist, one assistant. You'd refer to a specialist, and, I got into it and having the mindset of, everything is possible, coming off a national championship, going to an amazing dental school that was actually a specialty dental school, everybody becomes a specialist, um, and then going to dentistry, I said, "We gotta reinvent this." It wasn't, I wanna reject this, for me, it was digging in deep, and a bit of my personality. I ended up going back to school specializing in what's known prosthodontics, which is the specialty of where aesthetics, structure, function, and biology all integrate. So you end up being a bit of an architect, but a driver of all of those important aspects of oral health. And that kind of, 35 years later, a journey of zigs and zags put me where I am today.
Yeah, and I love that you have, pioneered so many different things like veneers in the '80s and, just taking things to the next level. And that's why I wanted to interview you on the show today. So let's talk about the oral microbiome and how that connects to our overall health and our longevity.
Yeah, thank you. Um, well, we all understand longevity, right? We read, we listen to podcasts like yours, and we realize that it comes down to a number of silos, a number of verticals of eating properly, food is medicine, of really managing the headwinds and the stress in our lives by all these different techniques, of how important motion and fitness is, and then we always talk about a fourth one that maybe some people don't think enough about is sleep, is getting into that deep regenerative sleep, being able to breathe. And in dentistry today, in fact, the dentists are not only aware, but there's many of us who really have therapeutics that you need to work with your sleep doctors, your MDs, but we have better answers for people with these type of issues with sleep and obstructive sleep apnea. But there is a fifth level that we talk about for longevity, and that's understanding the oral microbiome. Now, why is that? The oral microbiome, when it is in dysbiosis, when it's out of balance, where the bad bacteria outnumber the good bacteria, when there's inflammation in the mouth, that dysbiosis works its way into almost every organ. 54 systemic inflammatory diseases, you name them, have a causality connection. In other words, a lot of these causes is a constellation of risk factors like cardiovascular disease. It's a number of things, and your inflammation in the mouth is one of them. So we say there is a fifth vertical of longevity. We call it dental longevity, but it's understanding the oral microbiome because it does seed the gut. So oral microbiome connectivity, gut microbiome is really that fifth level of longevity. And so what we do now in dentistry, and I'm trying to lead a bit of the charge and create awareness to both in the profession, to the professionals, and also to our patients. I have a third book coming out in September all about this. The connection of the mouth and the body is to make people aware of the importance of the health of the mouth. And the crazy thing is, it's not that hard to keep yourself healthy in your mouth.
Yeah, I mean, one of the worst things people can do is use mouthwash with really alcohol and harsh chemicals. And just it gives you fresh breath. Yes, we love that. I love fresh breath, but I want to be healthy more than I want to have super fresh breath. So, what's your take on using really strong antimicrobial mouthwashes?
Right, great questions. You don't wanna cause dysbiosis the other way. Antibacterials kill out these population of what we call commensals, or the good bacteria. That's the balancing act of good versus bad. So if you have there's 7 bad bacteria of inflammation, the pathogenic bacteria, Actinomyces concomitans and PG, Porphyromonas gingivalis, and Treponema, and there's 7 of them. And all of a sudden, remember, the healthy mouth, like the healthy gut, is a diversified microflora. Diversified is the word. It's like we live in a community and we have all kinds of people in that community and everybody's living well together. But when the environment changes and when all of a sudden you decrease the saliva in your mouth because you got alcohol in your mouthwash, or that you're on an anti-cancer drug that's decreasing saliva, or as we age, salivary flow decreases. Remember, saliva is the beautiful body's buffering agent of the mouth. But when that pH, that acid-base balance, that acid goes too low, the pH is under 7, 6, 5, 4, you set up an environment for both the teeth to be demineralized, demin, so it breaks down, and you set up an environment for the bad bacteria to grow. So alcohol and mouthwash, that's a no-no. Eating the type of foods that are both acidic and sugary, that's a no-no. So there's many things we can talk about, but it's creating a healthy environment like in the rest of our body, where we take care of our body, and what we put in is what we're gonna get out, right? And it is, it's the greatest thing. The old comment of, nutrition and food is that's our medicine, and we just have to be aware. People aren't aware enough of what you need to do to have a healthy oral microbiome, but once you learn, it's easy. It just takes a little bit of diligence and discipline.
Yeah, I started using a probiotic
Yeah,
supplement, so after I brush my teeth at night, I'll use
excellent.
this probiotics. Do you recommend those
Oh,
for my patients?
absolutely.
Okay, great. Yeah, I use one called Gaia.
Yeah, I
Is there
know it.
one that
Yeah, I
you
like Gaia.
recommend?
I like Gaia. There's a number of them. I work with a company called Bristol Health. I, advise them. They're a startup. We do salivary diagnostics with them. Fantastic company. 200 different bacteria are tested. They have their own, probiotic, but it's basically you got a bug, the ones that cause decay is called Streptococcus mutans or strep mutans, and the probiotic you take with Gaia has what's called Strep salivarius, and so it doesn't cause any of that colonization that's going to break down the sugars to cause acid to then let that acid, kind of the bugs burrow into the enamel and to start breaking down that enamel structure of the tooth, which is the hardest surface of the body. So you could imagine, you got to work pretty hard to kind of mess up your mouth. But if you really avoid this this important home care regimen, and we could hear it in our ears. Mom knows best. She's telling you, did you brush? Did you do this? And so today we just have to make it, pretty simple and easy for people. And we spend a lot of time as professionals with the whole team because I live with my team. I've also invented products, but products that make it easier. And products and services and education makes it easy for people to understand what they need to do and then so it doesn't take too long.
Yes, and so and I think that's amazing that you can take an oral probiotic and prevent cavities. And that's the whole reason I'm taking it because my entire mouth, almost every single tooth, has a filling in it. Just growing up, not having the best practices and loving sugar when I was younger. And I also with mercury fillings, because mercury is an antimicrobial, I assume that that will also destroy the oral microbiome as well.
Well, I mean, that's a whole nother conversation. There are many things that can destroy the microbiome, and that's one of the big things. But the other big thing is mercury is a neurotoxin. And the latest studies, and look, they banned it in Sweden 27 years ago. The EU banned it about 4 or 5 years ago using amalgams and mercury fillings. It's a big conversation, but truly, it's something that the American Dental Association has to really look at the most immediate science on this. And it really shows, especially with these older amalgams, not only do they're prone to getting decay underneath because they've been used in people's mouths for decades, but the mercury vapor comes off. And that's the neurotoxicity of it. And so it's very important for dentists. As prosthodontists, we use what's called a rubber dam, high-speed suction, and really getting them out in a way that you don't have any environmental issues with it, with people in the room and with the patient. And it can very successfully be taken out, decay cleaned out, and of course, put in restorations that are very, very biocompatible.
Do you recommend that if anyone currently has mercury in their mouth that they get it removed?
I never did until I read over the last 5 years the most recent studies. I only take amalgams out in the past where I felt that there was either decay underneath, it was leaking, there was an open contact, so they were trapping floss, it was a rough surface that couldn't be polished. But today, because of the modern science, I will and I can tell you personally speaking, when I had my heavy metals tested, I had one I had 2 amalgams, and I took it out, and my numbers got better, and there's so much evidence of this that you just do have to get your amalgams out, but you just have to have it done in offices that understand the, necessary procedures that have to be done to keep it safe.
Yeah, I can't imagine getting your mercury fillings removed from a regular dentist where they're not using any protective mechanism for you or even for themselves. I mean, dentists have the highest suicide rate because they can be if all the professions because they have such high mercury exposure. For the ones that are still doing that, that's a statistic that I read. But what I was,
I don't know, I think that's an old stat.
maybe.
I know I'm a pretty happy guy, and I always surround
But you're
myself with
not
happy
doing mercury. You're not, but
No.
it's related to the mercury exposure.
Well, Mad Hatter's disease, right? But, I haven't done a silver filling in 35 years, but
Yeah, I mean, I had 5 mercury fillings removed when I was 21, and just for aesthetic reasons. I'm like, "Let's switch to this white composite filling so I don't have these dark fillings in my mouth," but it was just the regular way, and I think following that, I had such a high mercury exposure, I experienced a lot of depression and other symptoms related to the release of all that mercury into my system, so here we are today,
here
talking
we are
about
today and
heavy metal
talking about
detox.
environmental toxins.
Yeah.
This is one of them.
Yes, and let's talk about aluminum in fillings. This is something that I had read, last year and was really surprised that there can be aluminum in composite fillings that people are choosing in lieu of mercury fillings. Can you talk about that and maybe how to
Yeah,
avoid those?
it's showing some toxicity, and look, the dental profession and dentists in general, it's like if you're a consumer and you're looking at what's on the ingredient list, you have to have the knowledge of what are the important ingredients that you should and should not have. There's 55 names of sugar, right? So everybody gets duped because they think they're not having sugar, but they got added sugar. It's the same thing for the professionals. The professionals have to understand the materials we have to use are completely biocompatible and tested. There are composites, of course, that are extremely safe. They've been used for decades. We use them for, sealants for the kids all the way to posterior resins for small cavities to bonding in ceramics. And it's just having knowledge of, what is really safe. So, this is one more thing that patients get educated. And when you go to your dentist, you ask them questions about this. Are you still doing amalgams? And it's the patient interview. And the dental team is interviewing the patient, but the patient is interviewing the dental team. There are many things, the first book I wrote, and one of the chapters was, Can You Trust Your Dentist? Which are what are these important things you have to look for? You move to New York, you move to Chicago, and you want to know, am I in the right office? And I will tell you at the top of the list is that are you in an office with multiple doctors? Number one. Are you in an office where the doctors are either lecturing, teaching part time, involved in continuing education? Are you in an office that has the latest technology? Because if you're in an office that it looks like it's 30 years old, the technology is 30 years old. And I got to tell you that it is unbelievable what's happening in dentistry today. It's a golden age. Everything's digital workflow, no more impressions, scan design manufacture, smile design off computers, 3D printed restorations, 3D printed casts. CAD/CAM are restorations, meaning we can biocopy natural teeth. A mom whose young daughter has a beautiful smile, she can have to the 10th of a millimeter, the exact shape of teeth for her ceramic restorations, so to speak. Biocopying. There's so much I can go on and on about it. The way we look at saliva and the way we do our salivary diagnostics. Why we built this new office. I have my office uptown for 35 years. We're 26 people, all the specialists under one roof, periodontists, orthodontists, prosthodontists, restorative docs, 4 hygienists, 3 ceramists, everybody together. I built a second office. I need my head examined. It's so much work. But I did it with my sons, and none of them, they're not dentists, but they understand branding, and they started a company called Twice, so they know oral care. And what's interesting is that because of the new technology, we can diagnose at such a high level that we believe that understanding the microbiome, understanding the airway, understanding a number of these factors that this dental longevity can lead to overall longevity because that connectivity of the mouth and the body.
And now a word from one of our sponsors. Two of the most powerful supplements for women's health are whey protein and creatine. Studies show that women have about 70 to 80% lower natural creatine stores than men, which impacts our muscle function, muscle recovery, our brain functioning, and even our mood. Pure Creatine Plus combines pure creatine monohydrate with taurine to support muscle strength, performance, muscle recovery, faster workout recovery, and cognitive health as well. And I love the results of taking creatine. I honestly had never taken creatine before in my life before I started taking the Pure Creatine, and I absolutely love its effect on my mental clarity. And it is also especially beneficial for both pre and post-menopausal women as well. It's shown in research to support bone health, improve cortisol response, support thyroid function, and so much more. And like everything that Puree makes, each batch of Creatine Plus is third-party tested for over 200 harmful contaminants, and it's clean certified by the Clean Label Project as well. So you're only getting clean, safe ingredients. And the test results are published online for complete transparency. All you have to do is scan the QR code on the bottle. Now let's talk about whey protein. So protein is essential for women. A lot of people are not getting enough protein. And many protein powders on the market are loaded with toxins and heavy metals and harmful contaminants. But the Clean Label Project reviewed over 160 top-selling protein powders in the US and found that 47% exceeded California Prop 65 safety limits for lead, with 21 containing double the acceptable amount. And so that's horrifying when you think about it and how many people are drinking protein shakes daily, believing that they're doing something healthy. And so that's why I use and trust Puree's PW1 whey protein. I absolutely love the vanilla flavor. It tastes incredible. I love the dark chocolate also. Like it tastes like a fancy chocolate milk, but it's clean and safe, not like a lot of other cacaos and chocolate products on the market. And my daughter Winter, loves the vanilla flavor. She loves making smoothies. And recently, Vogue also named Puree PW1 whey protein the best overall whey protein powder. And for all the right reasons, if you ask me. Like I said, my daughter's making smoothies daily, and I have peace of mind knowing that she's using this protein powder that's clean, pure, and safe, and it's been tested for purity. And so here's how I use the PW1 and the creatine every morning. I make a shake with coconut water, a scoop of the PW1 protein and the creatine plus, and I add berries, maybe a banana, some dates, a little pinch of salt. And that helps me stay strong, focused, and energized throughout the day. And I know that I feel good knowing that I'm fueling my body with truly clean supplements. And so go feel the difference for yourself. Taste the difference also. Go to puree.com/Wendy and use code Wendy at checkout for 20% off. Again, that's PUORI.com/Wendy. And that code even works on your already discounted subscriptions, giving you almost a third off of the regular price. So don't wait. Go try the PW and the Creatine Plus today. Clean, science-backed supplements that you can actually trust. Again, go to puree.com/Wendy and use coupon code Wendy. You're going way beyond biological dentistry because, you hear different podcasts and they recommend going to biological dentists, but you're just going above and beyond that, just doing so many high-tech scans and salivary testing, which I'd never heard about that. Can you talk a little about your practice and what you're trying to do, be above and beyond a typical dentist?
Well, my branding sons, about 5, 6 years ago, this is when they were building twice, they come to me and they had this idea of changing the whole patient journey. Now, that's what we tried to do uptown. But you walk into my office uptown, it's beautiful, it's glass and it's really kind of cool looking. But you're in a dental office. And they had this vision that it shouldn't look like a dental office. And we want to call it something and do this and do that. And so I said, look, guys, when you get stop with this company you're doing and you get some time, let's talk about this. And the concept was Smile House. And where it evolved to was because of what we figured out in the Uptown office is where those 4 domains of looking at aesthetics when people feel that they need to improve their smile. looking at the structures, which we get from now every patient for the last 7 years in our practices get a CAT scan for your jaws, which tells you everything from the top of the nose, airway, sinus, joint, jaws, size of your jaws, and this airway that we breathe in. And you see numbers from 441 square centimeters all the way to 21. 21 is like breathing through a very skinny straw. And I can say, "You have trouble breathing," and I ask them 7 questions, and I know they do. And then I'll say to somebody who's got 200, "And you would sleep great." So, "I sleep great." So it's a very interesting thing. There's so much science behind this, but to kind of, get that conversation understood, we look at structure, the function, we scan the jaws, we could see how the teeth come together. This mandible has a temporomandibular joint. It's a very unique joint that rotates and translates. And so you got to protect your joint because people end up having a lot of stresses, hold a lot of stresses in your jaw, and they have this whole TMJ and PD problem. There's so many things, conservative things we could do for that. So we look at that function, and then we, of course, look at biology, and biology is a big deal. That's your salivary diagnostics, understanding your microbiome, your periodontal assessment. It's so important that the gums around the teeth are healthy. That's that's the cuff of tissue that has to be pink and tight and not red and inflamed. It's a fiber attachment to that tooth structure, and that's how, when it's inflamed, leaky gut, leaky gums. Leaky gums mean those bacteria that are pathogenic form something called it's a foreign invader, an endotoxin. It's the breakdown of those bacteria. Guess what? That gets into the bloodstream. Guess what? The bloodstream's the superhighway, as we all know, and it ends up, you name it, amyloid plaque of the brain, pancreas of pancreatic cancer, interstitial cells of leaky gut, on and on. Of course, cardiovascular disease in the carotid artery of patients. So when you look at studies from 20 years ago, Moisey Devereaux's group in Columbia linking cardiovascular disease to inflammation in the mouth. You go to what happened over COVID, you were 5.4 times more likely to end up on a ventilator if you had periodontal disease. Why? Another level of inflammation shutting down the overwhelmed already immune response from the foreign invaders, right? Think of, we have a castle and they're attacking us from every angle, and your troops are getting overwhelmed. That's our inflammatory response. Easy way to think of our immune response. So we look at these areas, and we do it in Smile House in a very cool way. I wanna give my boys the shout out of that and the visual, and you walk into it, you think you're in kind of a cool members club. It doesn't look like a dental office. It's quite beautiful, and we were very fortunate to do that because we wanna really change the perception. Me personally, I'm, like, on a mission. I wanna change the perception of the profession. Dentists are not dentists because it's a negative connotation. We're oral physicians. The mouth is connected to the rest of the body. What happens in the mouth goes to the body. It's easy, and the truth of the matter is doctors really don't have a clue about what we know, and vice versa. What I've made it my mission to really understand the human body, because then it's easier for me to help connect the dots and understand how these new technologies work. So when we look at those 4 domains, we connect it in a way that's engaging for the patient and explain it visually. And my son Cody gave it the name mouth mapping. We map the mouth for the patient within those 4 domains for dental longevity. So we call it the Center for Dental Longevity. And it's very unique because we want this to become a standard for the profession. Standard of taking a CBCT for a patient, standard of doing these itero scans, salivary diagnostics, periodontal probing. When you do oral cancer exams, when you do all these things, now you have an opportunity for patients to be very healthy. And guess what they learn? They learn the oral hygiene regimen. And so we have a guide, happy to send it to everybody listening, that really lays out, here's what you do first, second, third, fourth. It's gonna take 2.5 to 3 minutes. You're gonna do it morning and night, and you know what you're gonna have? You're gonna have game, right? It's like a good tennis game, you're gonna have oral hygiene game, we like to call it. And you're gonna feel so much. You're gonna feel so much, healthier. Your breath is gonna be better because the same bugs that are causing inflamed gums hide in the recesses of the tongue, and that's what causes the bad breath. So, and then you have good-looking teeth because, you're getting the plaque off so the stain doesn't get access. So on and on and on. It's so positive to create that oral hygiene game, to get the discipline to, really learn about the regimen and then just follow through with it.
Yeah, my personal doctor, he does bioenergetic testing to look at all of your teeth because it's so important. You have meridians through every teeth, going to every different part of your body, and it's going to affect those organs and systems on that tooth meridian if there's an infection or a root canal or some other problem going on. And it makes so much sense that if you have periodontal disease or you're moving in that direction, that's just, more load on your immune system that it has to deal with is totally unnecessary and preventable. But let's talk about, the oral structure and sleep apnea because this is something my father had. He just, didn't wanna do a sleep study, didn't get diagnosed for 20 years. It definitely killed him. It definitely he was waking up 70 times a night, when he finally went and got his sleep study, but it just destroys your brain cells and your health. Can you talk about, what are some of the signs of sleep apnea and kind of the testing that you're doing to look at that airway and the structure of your mouth?
Of course. I would just turn back the clock a little bit on the question and just say this. In the growth and development, and this is great for the young moms, there are things that young moms can do to help prevent structural issues for their children, because it's very important to know this. If you're a mouth breather, you're not using your nose. Your nose is designed for breathing. It's got a filter systems. It's where we have the antibodies and the filter systems and all these kind of great molecules to really help slow down and kill some of these foreign invaders. We breathe through the nose. What happens when we breathe through our mouth? When the young children are growing up and they have a rhinitis or a sinusitis and it's chronic, they start breathing through the mouth. When they start breathing through the mouth, and anybody who read Breath, which was a fantastic book that just started to get the word out to the consumer. And these are studies, they're amazing, orthodontists and researchers. Um, so Paul Ehrlich and Sandra Kahn wrote a wonderful book, Jaws, Stanford educated orthodontist teacher, PhD, Sandra. And it's what they found is that when the children are breathing through the mouth, the formation of the palate gets very high, almost like a tunnel, and it gets narrow, and the lower third of the face gets long, we call them dolichocephalic, and they start leaning forward, and the posture changes, and you end up with jaws that are very small,
And they can get kind of a recessed chin also.
and you get a recessed chin, and guess what happens to the tongue and the airway? The tongue goes back, the airway is closed down. What happens when the opposite happens? It's also hard foods they showed. It was Cortacini's work, a number of great researchers over the last 30 years. When you use hard foods, the jaws develop beautifully. Bottle feeding versus breastfeeding, that difference also, you develop better jaw development with breastfeeding. And so a number of these things, and the big thing is mouth versus nasal breathing, will determine the development of the jaws. Now, if you have a small jaw, you're fighting where do you put your tongue. Think about the tongue sitting in a studio apartment and it needs a penthouse, as my colleague Mark Brahen would say. And so thinking about that, what we do in dentistry with adults, we can expand the jaws just like they do with the children, and there's a couple of great techniques. We could move the jaw forward, which moves the tongue forward, which opens the airway. And we can teach the patient where to put the tongue when they're sleeping to get it right behind the front teeth to start developing, and we have these new appliances and devices to do that. On top of that, we can take these palatal tissues that as we age go further down the throat. They're called palatal pharyngeal vault, and we use medical dental laser called Photona, which has something called night laser that pulls it up. You really want to do a number of these together, but the key is diagnosis. And the key is to look at the airway. We do that routinely through our cone beams, our CBCT. It's looking at the palatal tissues of the throat, and it's going through a sleep quiz, which leads to a sleep test to see that important AHI ratio you described as waking 70 times up. It's the apoxia hypoxia index, which basically says when am I running out of oxygen? Because that's when you wake up. And so all of these determinants will then lead to people starting to snore, which is really the early stage of OSA when it's a structural problem. And then you start get into a slight to moderate. And what the medical profession has, I don't want to beat up my medical colleagues too much, but it's really the insurance companies have pushed a CPAP machine. Now, a CPAP machine is good for the acute moment, but it's not a long-term answer. Could you imagine you have this mask and it's
People
on your
hate them.
face?
They don't wear them because they can't stand them.
They can't stand them. It's a petri dish. You're breathing in bacteria, and it's a terrible issue. But we have better answers. And so the dental team has to work with the medical team to get that diagnosis. But the dental team, when you really know your stuff and you have the specialists working together, and I believe the future of dentistry is the specialists all under one roof. Nothing lost in communication. That's a whole nother conversation. So we have everybody under one roof because we work collaboratively. On Friday mornings, we put up our patient information that we saw during the week, the new patients. We go through that data. It's like grand rounds for medicine, but it's for dentistry. And now everybody's weighing in. And that's the way, healthcare has to be, because you're getting multiple sets of eyes looking at what's going on. We can diagnose correctly. And then the treatment plan becomes what is the most appropriate one.
And now a word from one of our sponsors of the Myers Detox podcast. So I want to tell you about a lip peptide treatment that I've been using, and I've gotten amazing results. And it was created to help you restore smoothness, fullness, and lasting hydration to your lips while protecting against visible signs of aging and environmental stress. And what I love most about this lip peptide treatment is that it contains True Energy's signature proprietary biophoton frequencies to enhance cellular communication, optimize ingredient absorption, support collagen production, and helps lips maintain their smooth, fuller appearance over time. Something I'm really into right now at age 53. And honestly, I can't ever see myself using any kind of skincare unless it has frequencies in it that enhances its effectiveness and sends new information to your skin and to your lips to improve their appearance. So this True Energy peptide contains plant-based botanical oils, vegan moisture sealing waxes, and a collagen boosting clinically studied peptide infuse the True Energy's signature frequencies to condition, smooth, and energize lips for a healthier, more youthful appearance. And each ingredient is also sourced to meet high purity standards and doesn't contain any synthetic fragrances, parabens, toxic ingredients, or harsh petrochemicals. So if you're ready to smooth away the look of fine lines around your lips, maintain lasting softness and hydration without stickiness, enhance natural lip volume and contour, protect against dryness, flaking, and environmental damage, and energize your own lips repair and renewal cycles, True Energy is offering a BOGO special, so you can buy one, get one free for a limited time for my listeners only. So go to trytrueenergy.com/Wendy3. So it's trytrueenergy.com/Wendy3 to get a buy one, get one offer. This is something that I use every single night. I absolutely love this product. Highly, highly recommend it. Yeah, and so as far as correcting your palate as a child, do you recommend mouth taping for children? Because I know I slept with my mouth open and I had no idea at that time, and I spent many, many years doing it, mouth breathing, and I, really regret it. I thought it was, I didn't know any better. So do you recommend mouth taping
I
for
I I
children?
I love mouth taping because, one, it forces the patient to breathe through their nose. When we do a CBCT, we can see if there's an obstruction where you have a deviated septum on one side, and I can't tell you how many referrals we make to the ENT. It's very important that the nose is working. So you put the mouth taping on, it becomes diagnostic. Now, a lot of times it becomes behavioral, so you mouth taped, and now they're pushed to use the nose, which is fantastic. So that's one very good for a diagnosis and for certain people. But a lot of times it's other things going on. And the other things could be all these things I'm describing, which is palatal tissue down the throats, small airway, small maxilla, small jaws. So you asked about the maxilla. We can expand the jaws of the children, right? We have these different appliances, the kids have them. You turn a screw in the palate, it expands it, there's a mid-suture line. Well, now we know for the last 8 to 10 years that you can do that in adults, and there's a surgery, in fact, that is fairly minimally invasive called SFOT, which you expand orthodontically, but the surgery is surgically facilitates that movement. There's a dentist from Fayetteville, Arkansas, named Rick Robley. He developed this technique about 25 years ago, and it's been fine-tuned extremely well. So that's all about the diagnosis. So it's good to know that people who do have small jaws can really be expanded. You can expand that basal bone, which then allows the tongue to move forward. But again, diagnosis is the key, and that's why you need to have a good team working together. We say move slow to go fast, the meaning go put your effort in up front, and then after you have your diagnosis, then it's just execution on a plan.
So since there's some people that are listening to this that, may not be able to come to New York City to Smile House and get their full diagnostics. Should they start with a at-home sleep test? Like, you can get them for a couple $100 online, and they put a little pulse on your finger. Do you recommend those, or using an Aura Ring to look at, oxygen saturation and things like
I
that?
love the Oura Ring. I love all those trackers. I think they're amazing. I mean, I personally put on an Oura Ring before I go to sleep because what happens, we know we might have had a little dessert too close to when we're sleeping. We had the phone on the end table, or the room's too hot, or, you had a drink with dinner and we know what alcohol does for sleep. And so it changed your behavior. Oh, wow, I got a 90 or I got a 65 or I got, so sleep is so critical, as we all know, and it's different phases of sleep, right? We have light sleep, we have that REM sleep for creativity, but we have that deep regenerative sleep that is absolutely critical, and that's where we really have to breathe, and we have to breathe through the nose and have a patent airway, an airway that is gonna support that. So, when you add up all these things, it starts to make sense, doesn't it? Where, we're becoming aware of what's so important. So if you're focused on the sleep, using an Aura Ring, using these trackers, they really do make a lot of sense.
Yeah, because it seems like it can be a first step to see if
Yes.
you do have an issue. I was having some sleep issues and trying to, troubleshoot it, and got an Aura Ring, and luckily I find out I have really high oxygen saturation. I don't feel like I'm waking up that much. So I felt like I could rule that out, sleep apnea, to a certain degree. Is there an at-home sleep test that you recommend to people? Maybe as a first step to where maybe once they figure that out, if they do have sleep apnea,
I would
then they go to that next
I
step.
would I would say that's an excellent way to think about it. You can do an Oura Ring or the Apple Watch or the Whoop, but you have some type of tracker that tees you up. What's your sleep like? Or your mate says to you, your significant other, that, you were snoring a lot last night. And so you look for specialty offices that have good diagnostic skills in that next level that you're describing. Sleep Image is a company we work with, and they wear a ring for a couple of days. They get a baseline and they see it over the couple of days. I work with a company called Sleep Architects that is promoting the education and the support to dental offices because it's hard sometimes for the dentist to understand all the little nuances that we're describing. So they're very supportive, and that's a great company. But it's finding and identifying a dental office, I think, that really focuses on the care of the patient. They do have this wonderful holistic approach of comprehensive dentistry, and I believe that, when you find that office, it's just making sure they have the latest technology, and when it comes to sleep, they have to have a CBCT machine. They have to be working also with their MDs because you really want to be able to diagnose that sleep test with a sleep doctor because there are things in there that, are really, need to be collaborative between the sleep doctor and the sleep dentist, and then make the diagnosis. Slight to moderate OSI, obstructive sleep apnea, great, here's the treatment. Instead of a CPAP that insurance companies cover, and that's why a lot of people have them, and then all the problems of long-term use, here are the options that you have through a dental office that's focused on this.
Yeah, and it's so important to get this tested. If you have any sleep issues, you're waking up exhausted,
Exactly.
you've got brain fog, or you just can't figure out what's going on, sleep is the foundation of health. You've got to get that, just ch check that box. And so doing a sleep study can be a great first step, not just for your oral health, but your whole health and longevity. And let's talk about the cone beam scan that you talked about. So, I've understood that to be looking at, cavitations to see if you've got holes in your gum from removed wisdom teeth and any problems that can be causing. What else is the cone beam scan used to diagnose?
Yeah. So, it's interesting that you talked about cavitations because that's something that's fairly new in understanding in the profession. But, and we could talk more about that. But from the top of the nose to the bottom of the airway, you have the structures. So everything in between. So we can diagnose a sinus. We can diagnose this upper jaw, which is the maxilla. We can diagnose the joint, which is the temporomandibular joint. That's that rotation translational joint. It's very unique in the body that's separated with a disc. And then you got to protect that joint. And what I mean by that is if you clench and grind your teeth, you're stressing. The muscles are pulling this disc, and all of a sudden you're hearing noises and popping, and then you have pain. And there's so many interceptive ways to calm everything down. And of course, why longevity is all about managing our stress and what we do in the morning and how we start our day with a lot of great energy and positivity and gratitude. But that's a whole nother conversation, right? So what we're seeing with the volumetric CBCT is we're seeing the ability to look at the housing of the bone around the tooth. What is that important? Nerve dying, failing root canal. We got to talk root canals because I'm hearing so much noise about root canals, and I want to really just set it straight. Um, so we can diagnose a LEO, a lesion of endodontic origin, a failed root canal. Okay, we'll talk about that. Periodontal disease, bone loss. Talk about that. A cyst in the jawbone. Talk about that. A condyle that you had trauma, and all of a sudden, instead of that beautiful rounded, it's flat, and you want to know why your jaw's dislocating when you open too wide, right? And we look at all these things, and then we get the airway, which is all about can you get into deep regenerative sleep, which is our future for health. Okay, so we really can see so much information, and when you think about it, think about the crossover between the connection of dentistry and medicine. And we don't talk to each other in general. It's totally disconnected. There's no universal health record, of course, in medicine, and there's absolutely no communication between dentistry and medicine. Well, guess who's beating the drum on this one? So I'm involved with a really cool group. Henry Schein, the company, is an amazing, innovative company and the largest dental company. And we're working on a project to help connect the dots with dentistry and medicine. And we call it DMI, dental medical integration. And what we're looking to do is to do certain things in the Dell office that we can share that data with our medical colleagues that allows them to get upstream and early in diagnostic of chronic inflammatory diseases. And what this will allow us to do is to be more proactive and move away from the sickness model that medicine lives in and to try to be one of these important pieces of the puzzle to get upstream and to get more into this wellness model. We like to say that dentistry can be the tip of the spear of preventing these chronic inflammatory diseases, and it's very exciting because why? People go to the dentist more than they go to their primary care physician, and we know what that problem is. So there are things that as dentistry gets elevated to do more than just fill a cavity. There's so much more that can get done because of this new technology and the new science and really all the great research that's come out in the last 20 years.
Yeah, I'm so upset that I missed my Smile House appointment yesterday because
Well, we'll get you back.
I was supposed to do one, but I got food poisoning, and so that went out the window. But we're here today talking about it, so I'm glad you could explain it. But yeah, let's talk about root canals. So, are you pro root canal? Because I know everyone that I've interviewed said don't get root canals. You got to pull the tooth and then get an implant, and that just seems incredibly invasive. And implants can fail, and they can and do. So, what is your recommendation? What are your thoughts?
Yeah. We're taking a subject that can be simplified quickly. Here you go. And we can liken it to many different industries, but at the bottom line, WD is greater than WS. That means well done is greater than well said. That's a Cornell lacrosse expression, but I had to bring that in. They just won a national championship this year, so the last time they won was our year, so I'm pretty proud of these guys. But meaning well done, when a root canal is done with what's called a three-dimensional fill. So if you looked at the end of the root where the necrotic debris, because the nerve died and the body thinks it's a foreign invader, and now you have an inflammatory response, fluid buildup at the end of the root, and guess what you have? Pain. You have these fibers that surround the ligament. They're called alpha afferents. What's the distance between a tooth and your brain? Short. How much is that pain if you've ever had a tooth pain problem? Great. So just think about it. That nerve has a short distance to travel. You got this fluid buildup, and where is it building? It's building in bone. What's bone? Inelastic, doesn't stretch. So that means you got a lot of pressure, pain. Okay. Root canal's done. If you look at the end of that apex, and if you cross-sectionalized it, in other words, looked at it from like chopped it and then looked at it, with a three-dimensional fill, it's going to fill all the way. But sometimes fills are like this. And what is there? A gap. So over time, that necrotic debris lays out, gets out there. Body thinks, now all over again, the process starts, and you have what's called a failed root canal. Failed root canal, body's immune response kicks into gear. Now your body's working overtime. It's chronic, and all these inflammatory diseases, it's when it gets chronic, it's in trouble, but you have to diagnose it. When you diagnose it, you want to diagnose it as early as possible, so you're not working overtime with your immune response. And that's where a CBCT allows us to see this clearing out of the bone because the inflammatory process destroys the bone. That root canal can be retreated, and a lot of times a root canal specialist, root canals need to be done by specialists or a highly trained general dentist who really knows how to do them. And usually the back teeth, which have very narrow, can you imagine you're running down a windy, narrow road? That's what a lot of these canals are, and some are hidden. In our first molars, we have something called MB2s. They're a second mesiobuccal canal that a lot of endodontists, even specialists in the microscopes, can miss. So it takes a lot of technique. But when done properly, they absolutely work. When you look at it on X-ray, you see a ligament. You don't see any cavitation. When they don't work, you see that cavitation, that hole in the bone. You have to do something about it. Your choice is to, yes, extract and place an implant or redo the root canal. All day long in anyone I know, my family or myself, I'd redo the root canal and make sure that we can get a three-dimensional fill and understand why it wasn't done in the first place for whatever reasons, because there is a level of technique sensitivity. But I will say over the last 35 years, a lot of it now is much less on technique sensitivity because the top root canal specialists, and here's something for the listeners, your root canal specialist should be working under a microscope every single time. And they should be using, always have a CBCT, a cone beam, so they could look at that tooth three-dimensionally because the two-dimensional X-ray doesn't give enough information. So those are two pearls to know that you're in the right root canal specialist office. If you have your general dentist who's not that well trained doing your molar root canals, you will have problems. Now talk about the extraction. You're extracting, you're traumatizing the body, you're placing an implant. When you have to do it, 97 to 99% success rate with osseointegrated implants that follows a protocol. If you're not diabetic and you're not a smoker, you're at that 97, 99% success rate. To take a tooth out because you need a root canal, I almost would go so far as to say it's malpractice, but I don't want to get too crazy. It's just that when you really understand the standard of care, root canals done well in the way I'm describing works 100% of the time. And with a good dental office, you're on top of any breakdown of those root canals so you can retreat them and then make a clinical decision. And oftentimes that's after 20, 25 years of use.
I want to say a couple words about one of our Myers Detox podcast sponsors, Qualia Senolytic. So it's a cutting edge formula designed to help your body eliminate senescent cells, also known as zombie cells. So these outdated cells, they hang around, draining your energy and slowing your workout recovery and causing all kinds of havoc and mayhem. So, backed by clinical research, Qualia Senolytic uses 9 plant-based compounds that support joint comfort, sharper focus, and better aging naturally. And here's the kicker: you only have to take it 2 days a month. Simple, backed by science, validated by research. You can try it risk-free with a 100-day money-back guarantee. Go to qualialife.com/Wendy. That's QUALIA life.com/Wendy and use code Wendy to get 15% off. You want to try Qualia Senolytic. This is something that I've been taking. It's part of my anti-aging protocol because getting older doesn't have to feel like it. Yeah, that's great. I'm glad that you clarified that because I have a root canal in one of my front teeth, and I've had it redone before. And when they took it out, the smell was just ungodly. It's just obviously very infected, and they were not using a microscope. Definitely not doing a cone beam scan or anything like that. So it's something I've worried about that. Thought maybe at some point I need to have that looked at again. But it's just really it gives one peace of mind that they don't have to extract that tooth and wait for it to heal and do months of, wait months for it to heal, and then you could still have a cavitation if there's a lot of infection there or some sort of problem. And so the implant to me just seems very aggressive. So,
And when it's necessary, it's a super tooth when done properly, and there's a whole protocol and system that has been developed since P.I. Branemark came over here from Sweden, which he developed a protocol in the late '60s. He was an orthopedic surgeon researcher, and he found that a titanium and they were looking at blood cells that they put into you have to be careful being a graduate student in Sweden because they'll use you as a guinea pig, and they put the little glass, windows that was made out of titanium to look at blood cells called diapedesis. Long story short, when he tried to take it out, it was attached to the bone because of osseointegration, meaning the connection of bone to titanium, which is such a biocompatible material. Anyway, this launched what he created as an orthopedic surgeon and his team, dental implants. And then he tested it for a decade and a half plus till he let it out to the rest of the world, and it changed implantology forever. And I was fortunate to be at the meeting at the Pierre Hotel in '87, and it was groundbreaking because the people doing implants before that didn't have the protocol down, didn't have the system. So here we are decades and decades later. It works, and it's beautiful, but when indicated, just like anything else. What I don't like, and if I could just say this, there are people out there that are causing scare techniques and scare tactics to get people to do things. And so what I would tell people is to try to get to the experts, and these are the specialists in these individual areas, to listen to the facts and create the fact base for yourself and then make a decision.
yeah, I've done that before too. I've gone to dentists, it seemed like really good biological dentists, and felt like the treatment plan was just over beyond what I felt like I needed intuitively, and then went and got a second opinion, as well, which I think is warranted, especially when you're looking at, "Hey, you need an implant and 5 cavities and this and that and just this huge bill." I think it warrants a second opinion.
It really does. I tell my patients that, patients that come to us, and, usually highly recommended. Half our practice comes from outside the city, and people come in. But it's good to get a second opinion. It's good to get a first opinion and then come for a second opinion, but you're getting validation, and what happens because we don't have enough, um, evaluation of technique, and because it is a fragmented industry still, that you can have a treatment plan for the same patient. 5 dentists might have 5 different treatment plans. So you gotta get the validation, but you have to become like anything else. We have to become our own doctors. We have to become educated. Once you become educated, then you listen to a group of different people, and you end up making an educated decision based on the facts. And so it takes a certain level of diligence to kinda dig in on that. Because a lot of times, "Oh, you have to go to my dentist because He's got a beautiful office, and he'll never hurt you, and his injection's great. That's fabulous, but you really gotta be able to check the boxes off on a number of these other things, and one of the most important things is this person who's the professional, and this goes for the doctors too, to have an attitude of being, of improving and enhancing patient outcomes. What are the new technologies? What is the new science and research saying? So that the books on my shelf are not 35 years old. The books on my shelf are the latest and the greatest, and that I'm part of that also. Those if you have access to care and you're one of those people who really wanna have the best care possible, then I would say take advantage of that, of those best people.
Let's talk about, wisdom teeth,
Sure.
because I think when people, start for me, I got my wisdom teeth, the little roots out when I was 18 years old. I only had them on the uppers, and I just assumed that everyone should have their wisdom teeth out, that I didn't know any better at the time. And is that the case? Should if you have wisdom teeth or they're impacting, should you automatically have them taken out, or there are situations where it's better to leave them in?
Yeah. Here's a question to the question. 400 years ago, did we have the same problem with wisdom teeth and the need for orthodontics? And this was really interesting studies that were done by these researchers back about 30, 40 years ago who took the skulls of 400-year-old and noticed that the maxillas and the jaws were very big. And that had everything to do with what we were talking about with eating hard foods and breastfeeding. Well, today, there is a greater need of wisdom tooth evaluation and a potential removal. And my philosophy personally on this is understanding the structures. When there's no room for the wisdom tooth and it is impossible to access and to clean, and it's infecting or pressing on the tooth in front of it, the second molars, then you can start building a rationale. On lower wisdom teeth, there are these limiting anatomical, structures called the mandibular nerve, and a lot of times, you first of all, you have to be looking at these cone beams again because you have to see, is that root sitting on that canal in that nerve? Because there are plenty of stories of people having numbness of their lip for their life and paresthesia, and that molar, that wisdom tooth could have stayed there, and it could stay there, and the worst that happens is they get a little infection of the tissue there, as long as it's not impacting the second molar. So, again, move slow to go fast, be keen on your diagnostics, go to an oral surgeon, expert, maybe get a second opinion, understand what are these limiting anatomical factors, and if it does have to come out, they just have to make sure that if there was partial infection there, that it's cleaned out extremely well. That's the problem with cavitations. If you just take out a tooth and you're not cleaning out a lot of that inflammatory process, then that never heals, you don't get bone fill, and then you constantly have these cavities that are infected that can impact the rest of the body.
Yeah, and I had that. I had a cavitation, even though I just had the little root of the tooth in my upper jaw. And I'm just relaying this story for anyone that may have had the wisdom teeth taken out and might have a cavitation, have some gram-negative bacteria or anaerobic bacteria that's growing in there, causing a chronic infection. So I had the little root taken out, and there's a little hole that's left over. And today, I assume people are filling it in with PRP and things like that to just fill in that hole. So I had these 2 cavitations. I went to Doctor, Alareza Panapor in Beverly Hills and had, uh, had the cavitation surgery, did the PRP, etcetera. And yeah, it seemed like it was a good thing to do just to rule out any kind of symptoms or health issues that might be caused by that. Do you have any recommendations on, whether people should, look to see if they have cavitations and that might be a root cause of their issues?
Yeah, look, it comes down to the diagnostics team that you go to and having the understanding that when they're looking at panos, panorexes, CBCTs specifically, panos are just two-dimensional, and so is the regular dental X-ray, but the cone beams, these computerized tomography, you see things three-dimensionally. So you have to take a very good look and to see, first it's patient history. Like, sometimes people never get wisdom teeth. So even though they don't have a wisdom tooth, it's like you have to ask the patient, when were they taken out? Did you have any problems with it? And is you can see where these cavities are. And so there's a whole technique to do that. And this science and research is 3 to 5 years old. It's very new, and it's very new within the profession. And, it goes to that there's a number of people, um, probably not scientific enough at this point because it's so new, that have, improvement of cognitive function, when it's on those meridians, when it has a decrease of brain fog. I've had a patient who, the dentist explained to him, a surgeon, that, some of the orthopedic issues he was having had a link up to it, and sure enough, it improved. So I do think people need to be in an office that they are diagnosing that, and once they diagnose this, they have a good treatment plan and know where to send the patient if they don't do the therapy themselves.
Yeah, so we've been talking about really complicated
That's
issues in
complicated.
dentistry.
Yeah,
Let's get back to some basics.
sure.
So for people that want to improve their oral microbiome and their mouth, can we talk about some of the more popular things that people are doing? Do you recommend oil pulling, for instance?
Well, I like that people are spending time with their oral hygiene game. And if they spend so much time oil pulling, I would like them to replace the oil pulling. I'm not gonna say it doesn't do anything, but that if you used an electric brush, you did your 2 minutes on that, a really good one, or a manual brush with great technique. The beauty of an electric brush does all the work for you, so it could be any one of them. It could be Sonic, it could be, the IO from Oral-B. But if you use electric brush and then you used a water flosser and then you used a pH raising rinse, which, I love that because it raises that pH because everybody has acidic drinks in their coffee, and oxygenates, which oxygenates, it does a great job balancing out those good versus bad bacteria. And you do a rinse and you do a tongue scraper. And then I like to finish also with, a regular floss. So, we have it all in this guide. And then you just spent 3.5 minutes in the bathroom, not 10, 15 minutes oil pulling. So,
Yeah, because you have to do it for 15 or 20
oh my
minutes.
god,
Who,
I
who
mean,
could
it's
do
like,
that?
you who is doing that? I mean, if you just had if you did everything I just said, and you did that morning and night, and a lot of people after a meal, they're just also brushing in the middle of the day, and they figure that out. But if you just do that morning and night, and you get yourself, you've had dentistry done, it's very important, continuous care, you get yourself in it 3 times a year, not twice a year. And you have a good office that's very preventive oriented, great hygienist, you're gonna have an incredibly healthy mouth. You're gonna have no inflammation, and any little inflammation, dental team is on it. So, I'm not against it, but I love that people are spending that much time, because you're spending that much time, I'd like to take it down by a factor of 5 and just get you a great oral hygiene regimen.
Okay, great. And then what about floss? There's a lot of controversy out there that the conventional floss at the grocery store has PFAS in them, and that's getting into your gums when you're flossing. Is there a floss that you recommend?
I do, there was the PTFEs that had Teflon in it, and people rejected that. There's very safe floss. The boys we developed with Twice is a very safe biocompatible floss that stretches slightly, so it's very nice for getting between tight contacts, and it's impregnated with sodium bicarbonate, and what that does, that raises the pH between the teeth, and between the teeth is really where you get periodontal disease because 'cause they're the hard to access areas. What people have to know is even though you brush, you have to have a way to get between the teeth. That's why water flossers and regular floss are so good, and now they have floss picks that does a great job of just very easy to get around your mouth because string floss is a little hard to manipulate for some people. So,
So that's called Twice.
yeah,
That's the
Twice. Yeah,
brand,
smiletwice.com
smiletwice.com.
and so I like their floss. I like, a lot, Johnson& and Johnson has a stretch floss also that's great, but it's, I would say non-PTFE at this point because we know about that. Anything that's going to leave something residual that could potentially be toxic, obviously we stay away from. But, the 2 things that you wanna do in the mouth is you wanna create an environment for the good bacteria to live in harmony with the bad bacteria. And so that is a neutral pH, and that is watching your diet. And what's amazing is all the rules apply for the body, apply to the mouth, right? Sugar is the enemy. We know all the sugar issues with that and pre-diabetic and diabetic and the percentage of the people in this country that are facing these maladies and these problems, which are totally preventable when it's a type 1 diabetes. Cardiovascular disease and obesity, totally preventable by understanding that food is our medicine and really become educated. And all these things that we talked about longevity in the beginning of fitness and then, stress management. And I'm just adding a number 5 to that, which is your oral microbiome.
And what is your take on fluoride? Because every fluoride or every toothpaste in the stores have fluoride in them. And then you go to the dentist, you're typically asked if you want a fluoride rinse. Are you for or against fluoride?
Okay. So as you know, because, we have a lot of controversy in this country about fluoride and taking fluoride out of water. This is another point where people have to get educated. The truth of the matter is that it was one of the greatest public health moves that we ever did in this country. It is completely dependent. The fact is with all of these type of chemicals or additives, or pharmaceuticals, it's all dose response. It's all how much are you taking? There are levels of fluoride that will cause bones to be brittle and brains to be wasted as a neurotoxin. Then there are levels that will get in the forming tooth, will make a tooth super strong with the hydroxyapatite molecule of enamel. Enamel is this magical lattice that has created the hardest structure in the body. It's quite amazing. But when you take fluoride as you're developing, so it's a 6 year molar, first molar, let's say, so 3.5, 4 years old, 5 years old, that tooth structure is going to be rock solid. And that caused, in the very early days when it was introduced, an incredible decrease of fluoride. Now, today, we have fluoride in the water. You can have fluoride in your toothpaste. You can have fluoride treatment in the pediatric office, and all of a sudden, you're getting over fluoridated. So you have to be conscious of the fact that, how much fluoride is happening in potentially for you. But the truth of the matter is that if you're watching it, you can make a decision if you don't wanna so you use a fluoride toothpaste, maybe you go to the dentist and maybe they put some topical fluoride on because you have recession, they don't want you to get decay on the root. You can make a decision on water. You can filter it out or you can't, or you don't want to. So you can make a decision on that. The biggest people that are gonna suffer from taking fluoride out of water is people who don't have access to care. And we're sensitive to that. We have a foundation called the Glow Good Foundation. I don't know if you know about it. And Lenny Kravitz 10 years ago said, "You gotta help my people." He's a patient. And 10 years ago, we started. And we have a 14-chair freestanding clinic. I bring doctors, which has got me into this whole connection of dentistry and medicine. I saw what we can do when we work together. Under one roof, doctors, dentists, dental specialists, technicians, and we take care of the people, and we go into the schools. But, I tell you this because if you don't have access to care, you don't have access to fluoride treatment. You're not that educated in brushing and flossing. And so the biggest line of defense we have is some fluoride in the drinking water. So the truth is that people are, really worried about fluoride in the water and having too much product, filter your water or bottled water without the fluoride, that it's not added, and just be conscious of it. But I will tell you at low levels, it will make your teeth harder, more impervious to decay, and the last thing you want, especially if I was a parent, is my kids to have a mouthful of decay. Of course, nutrition and sugar and all of those things are addedly, incredibly important.
So, for anyone listening that really wants to detox their body, go to heavymetalsquiz.com. I created a quiz for you. It only takes a couple of seconds. Based on some lifestyle questions, you can get your toxicity score and get a free video series that answers all of your frequently asked questions about how to detox your body. Check it out, heavymetalsquiz.com.
Yes. And what about hydroxyapatite?
Yes.
Is that a good alternative to fluoride? Because, I use a toothpaste with hydroxyapatite to accomplish the same thing as fluoride. Is it just as good or do you recommend it?
Yeah. So molecules like that are getting developed over the last 10 years. There's HA, hydroxyapatite. There's also nano HA, which is molecules are 10 to the minus ninth. They're very small. What you're trying to do with remineralization is when our saliva is neutral, is designed to remin the teeth. That's just our body's one of our wonderful protective mechanisms. But when the environment gets too acidic, what happens? Remin turns to demin. We're breaking it down. Okay. These ingredients are getting added to toothpaste to add back some of these important calcium and calcium phosphates onto the tooth and to form a protective barrier. And what they found from the latest studies is that not only hydroxyapatite topically, but better nanohydroxyapatite, the very small molecules. And I think we'll see products out there that if you don't want to have fluoride in your toothpaste, you'll have an alternative like an HA or a nano HA to use. And of course, you got to have a good oral hygiene game to make sure that nothing's between the teeth. One of something you might not have heard about, I have had many of my patients walk in and I hadn't seen them in 6, 7 months, and they're older, and there's recession as we age. There's a recession, so the roots are now exposed. Enamel is the protective layer of our teeth, but the roots don't have enamels. You have something called cementum, very decay prone. And as we age, what happens? Our saliva lowers, or maybe there's a medication that a patient is on. Lower saliva, and guess what they might do at night? They might do a gummy to go to bed. And you do a gummy loaded with sugar, and people have to read the ingredient list. Any sugar in that gummy, do not touch it, because they'll go to sleep. They didn't clean between the teeth, and guess what happens? A mouthful of decay. And root decay is root canals, crowns, posts, implants, the most expensive dentistry. And when I said to the patient, "Are you using gummies?" And there's all these gummies now with melatonin, and they want to sleep better, or a CBD gummy. You just got to be really, really careful what the carrier is, because many of them are with sugar, and that is a problem.
Yeah, that's a
It's
really,
really
really good
important for
point.
people to know.
Yeah, because a lot of people are taking those and then just think they brush their teeth afterwards, and
Still stuck
it's
between the
still,
teeth.
yeah.
So if you
Mhm.
do it, you really gotta be a maniac with getting everything out from between. That's why I love the water flossers, in addition to the electric brush, in addition to the floss. You gotta do all the little pieces to the puzzle again.
Okay, great. So why don't you tell us about Smile House and, where people can go and get this really extensive, like, 2-hour
Oh.
mouth mapping appointment?
Yeah, well, we gotta get you back in.
Yeah.
It's, uh, it's it's 4 blocks from here, 55 Warren Street. The website is smilehouse, house.co. And, at 55 Warren, we lovely facility that we built that was a good year of planning and building, the City of New York landmark building on 2 floors. But, I think it's, gonna be a journey for people that, if you looked at the reviews on Google, it's like, "I've never seen anything like this." We have an esthetician that does jaw release massage because, we live in New York and everybody's a little tense. So we like to relax them before and after the appointment. But it's all those little touches. We believe in something called hospitality, like hospitality, where we really are very thoughtful about all the little things we do to kinda make an amazing experience for people to really, what I say is we're gonna make dentistry cool and for people to look forward to having an appointment, and that's the goal. And I'm hopeful that, the young dentists who have all the tremendous energy will pick up on this idea. I love when we could lead and we can get a standard of care in the profession, and then all boats will rise with that tide. But, go to our website, and my Instagram's at Dr. Jon Levine, where we post up, all the videos. But our Smile House landing page on our website, people can make an appointment right there on the website.
Okay, fantastic. Well, highly, highly recommended to get this very thorough I was surprised that it was a 2-hour testing and doing salivary testing and very, very comprehensive. So, and you can start there even if you're not in New York or going to go to your dental practice. You can at least get a super comprehensive evaluation to figure out what's going on with you. And
You can, and we have it where I say to, my team is people gonna say, "I just want a cleaning." And that's okay because that's the context that they've had in the past. Once they see what we're doing, they get educated. Everybody who said that, then ends up having a mouth mapping at the next appointment. Or people want a tour, so we have the ability for people to see what they have. You come to New York, come have a tour, come see what we're doing. And I love Zoom calls, and I get on Zoom calls with people who are in LA. I refer to my friends, my colleagues there. I'm part of a group, 175 of us that are global, that are very focused on these type of things and are specialists. So we can make referrals to people so that, they can get a tremendous level of care.
Great. Well, Dr. Levine, thank you so much
Pleasure.
for joining me on the Myers Detox podcast. And everyone, thanks so much for tuning in to the Myers Detox show, where every week I bring experts from around the world to help you upgrade what you're doing in your health and really get you thinking about ways that you can improve every area of your health, anti-aging, and live the longest, healthiest life that you can. That's what I really want for you.
The Myers Detox podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.